I'm Dr. Bruce Hensel, Chief Medical Officer of Language Access Network and Chief Medical Correspondent for NBC in Los Angeles. You're watching this tape because you've been told that you or somebody you're responsible for needs a spinal tap, what we call an LP or lumbar puncture. Now, realize this tape does not replace the papers you've been given to sign. You need to read and sign those if you agree to have the test. Now, it's your right, your choice, if you don't want it. But the doctor has told you that the risk of not having it is greater than the risk of having it. So I'm going to tell you about the procedure so you'll be informed and know what you're being asked to sign consent for. After viewing the tape, don't sign until all of your questions are answered. And don't be afraid to ask. No question is foolish. Now, first of all, you do not need to be frightened. I'll explain every step, what you'll feel, what the reasons are for having this procedure, and what will be done. And I'll talk about risks and benefits. And I'll even mention some questions you may want to ask. This is a model of your spine. Now, these are the bones that you feel in your back. We call them vertebrae. Between them are spongy material called discs. They're like shock absorbers. Inside here is the spinal cord and fluid that we call cerebrospinal fluid, or CSF. During the spinal tap, the doctor will insert a needle into here to take a few drops just to study. I'll show you the exact procedure in a moment. Some of the reasons for a spinal tap are to check for infection, bleeding, a change in pressure, or to give medicines into that area. Now, doctors may not want to do an LP spinal tap if a person has bleeding problems or increased brain pressure, skin infections over the area. Make sure to tell the doctor if you have curvature of the spine. The doctor will want to be specific and careful there. And also tell the doctor about any allergies so he or she can avoid causing a problem. If you're on aspirin or other medicines that affect bleeding, tell the doctor that too. He or she may want to delay the procedure or take steps to protect you. You may also want to ask if you need sedatives. In certain cases, that's a good idea. In others, the doctors may want to avoid medicines like that because he or she needs you to be awake and follow instructions. In any case, make sure to ask. In most cases, when the procedure begins, the doctor will have you lie on your side with your knees drawn up, sort of like a fetal position. Once in a while, if your history or condition requires it, we may do the procedure with you sitting up. The doctor may then feel your spine and mark the area to be studied. He or she may wait until the procedure starts. The nurses and doctor will practice total sterile procedure. Mention that. They should wash their hands, place clean sterile drapes or towels around the area, then clean off the area with sterile betadine or alcohol. Next, your skin will be numbed with a tiny needle that contains numbing medicine. You'll feel a prick-like sting and then some pressure as we go deeper. Now, he or she will then tell you that they are inserting the needle and headed toward that canal. Here's the needle. I know it looks scary, but it has to be this long so that we can get into the canal. And believe it or not, you really will not feel much pain. The doctor may have to try a few times to make sure he or she is in the right place. When he or she is, you should be told that you need to lie very still, and you shouldn't feel much after that. The doctor will then test the pressure in the spinal column and place a tube next to the outside opening right under the needle. You won't see it as it's being done, but ask to see it once it's collected. The drops of fluid will be sent to the lab for study. The doctor should then remove the needle, clean the area, and cover it with a sterile dressing. The entire procedure should take less than half an hour, maybe just a few minutes. Now, side effects are rare, but they do occur. They include infection, inflammation, even numbness and paralysis. But doctors and you can prevent those problems in most cases. You may have heard some people get headaches after a spinal tap. Now, that happens about 5 to 40% of the time, depending upon which study you read. What's it due to? Tiny leaks of fluid into the tissue around. Now, the body replenishes that fluid. Keep in mind, 60% of people don't get headaches. If you do, they may start 48 hours after the procedure and last 2 days or even less. It may worsen when you're in upright position, and it may lessen when you lie flat. Younger people and males have an increased risk of headaches than older people and females. You reduce your risk of getting a headache by drinking plenty of fluids. Now, occasionally, the only way to treat the headache is with something called a blood patch. The doctor will inject a small amount of your own blood at the site. You'll experience relief in as little as 30 minutes. In addition to headaches, you may feel pain or tenderness around the area. It might even radiate to your legs. Bleeding, as I said, may occur. It may even go into the nervous system, but rarely more serious complications like brainstem swelling can occur, and that can be very dangerous. The doctor can avoid this by taking a CAT scan or MRI of the brain beforehand to make sure. Infection at the puncture site or on the nervous system is possible but very rare, and that can be prevented with sterile techniques, the ones I described. Sometimes they can occur. Cyst formation rarely occurs after a tap. That can happen if skin-like tissues are carried into the canal. You can avoid this by asking your doctor to make sure that he or she uses a needle with a stylet. This is a stylet that prevents carriage of tissues inward. Now, I've done hundreds of spinal taps. I've never seen a serious complication. But because they do occur, make sure to report side effects right after the procedure or later. Ask the doctor when your results will be back and what he or she wants you to do in the meantime. Do you need medicines? Do you need to take steps to reduce side effects? When you get the results, you may be pleasantly surprised to learn the spinal tap showed there was nothing to worry about. If it does show something, early detection and treatment will increase your chance of full recovery. Now, please read the consent form and ask anything that comes to mind before signing. As I said at the beginning of this tape, it's your right to refuse, but your doctor feels the risk of not doing the test outweighs the risk of having it done. But it's your body, it's your right.